And welcome back to Body Beautiful. We're talking right now with Dr. Joseph Mealy. We'll be taking your calls, I promise, with any questions about cosmetic surgery. The phone number to call, 800-440-4884. We'll also be posting the number for the doctors as well during and at the end of each of these segments. So when you call Dr. Mealy's office and happen to mention Body Beautiful, you will receive a complimentary consultation. And remember, any advice we give you today, obviously, you're going to want to consult your very own physician, Dr. Mealy. You brought with you some before and after pictures, and I always want to get to those because it says so much. So let's go ahead and start getting a look at some of these pictures.
The first one is liposuction. So it's a gentleman, obviously in good shape, has a persistent area on his belly, just wouldn't go away. And we're able to, with liposuction, choose those areas and reduce that, the bulge.
And also...
And there's the after.
There's an after too. I'm also seeing something about gynecomastia?
Gynecomastia, if you look at his chest, it's also been reduced in size. Gynecomastia is a male enlargement of the breast. Sometimes it can be reduced with liposuction. Sometimes it requires surgery to directly excise glandular tissue if it's real thick.
And this is like a hormonal thing, or
it usually shows up around puberty. Sometimes it's temporary, sometimes it's persistent. Medications can also cause it.
All right, and we're now looking at a
little bit lower. Here? This is a tummy tuck. This is someone also in pretty good shape, though it's hard to see from the shape of her belly after having children.
Childbirth and
so not a lot of fat there. It's really just loose skin and muscle, and we're able to tighten that back up and smooth it.
And she must be quite happy about that. And that's just with liposuction
no,
and a tummy tuck as well.
Okay. That's a tummy tuck.
Oh, very okay. So. And this lady here.
And totally different area. I like to roam all over the body.
Okay.
This is a lady who came in considering rhinoplasty for a bump on their nose. And also chin augmentation.
Okay.
Their chin is slightly back behind the front of the lips.
Wow.
And this is with those changes. And a little bit goes a long way in those arenas.
They look like very subtle changes, but overall,
put together, it's very pleasant.
Very nice. So this is something that you do. You've done the tummy tuck, the rhinoplasty, the chin augmentation.
That's what got me into plastic surgery. It's that variety.
Okay. We've got an email here, and again, I want to get to these calls, so we may as well jump into this one. This one is from Tiffany in Walnut Creek in your backyard. I saw an ad for a permanent facial filler. Is this safe? Big question. Can you answer that, Doctor?
That's a great question. The concept of permanent on a face doesn't make complete sense to me. Permanent fillers should be permanent and last forever. And some of them do. They do persist forever, but the face is always changing. If we look at pictures of ourselves 5 years ago compared to now, we look different. And even if you correct things perfectly, in 5 years it's going to change. It will probably need to be replaced. So we may need to add more to it even though it's permanent. Some of the fillers that they're using permanent are silicone based. Those are not currently FDA approved, and I can't really recommend them at this point in time. Most of the fillers that we're using these days are hyaluronic acid based, which sounds bad, but it's a normal component of skin, and it tends to persist for 9 to 12 months in many cases.
Okay, which is about all really you want.
Which is about when the face is changing anyway.
I gotcha. Well, we've got a call here from Elaine in San Francisco. It looks like you have a question that's related to facelifts. Good morning.
Yes, good morning.
Hi, do you have a question?
Yes, I wanted to know, how long does generally a non-surgical facelift last, such as like maybe the lifestyle lift?
That's a good question, and that's a real area of debate. Some of the non-surgical facelifts still require minor surgery. Some will use sutures to help suspend the skin, and in those cases, suture suspension, it probably doesn't last too long, maybe a year or so. Some of the newer sutures are barbed. We may get longer lasting results from that, but I'm a little concerned of what happens to barbed sutures when they're left in the body for a long time. So it's not something I currently do, so I'm probably not the best person to ask in terms of how long it's going to last.
And the lifestyle lift is a surgical procedure, is it not?
A surgical procedure.
It may come across as a non-surgical, but yeah, there is cutting.
It is. I think it started as these non-surgical sort of suture suspension lifts. Plastic surgeons kind of gave up on that a long time ago just because it doesn't last very long. And so they've combined it with more of a mini facelift to give it a little more oomph. And in the correct patient, it's going to work very well.
Right. Okay. All right. I hope that answered your question. Of course, Elaine, if you have more questions, you can call the doctor yourself. Also, let's take another call. Hopefully we have time for that. Sylvia from San Francisco. Good morning.
Good morning.
Your question for the doctor?
Yes, I want to do my breast implant, and I want to know, I'm very scared.
You're considering getting breast implants placed?
Yes.
You're scared, okay. That's pretty normal. I always worry when my patients don't have any concerns. That makes me very nervous. I think you need to feel comfortable, so it's important to talk with your plastic surgeon, ask them what to expect, ask them what kind of recovery there is, what's involved with the surgery, what are the risks and benefits. There are several types of implants available right now. You want to pick the one that makes the most sense to you.
All right, wise question. Always good
Excellent
to do your research, Sylvia. And for more information about Dr. Mealy, you can call him directly, 925-943-6353, or go to drmealy.com. Thank you so much for joining us.
Thank you for having me.
I barely scratched the surface.
It goes so fast.
It does, doesn't it?